Howdy, this is George Allen here on Main Street, Warrenton, by the courthouse in Fauquier County. And a beautiful fall day. We've had a great week, and with great elections, so many good men and women won, and there were a few of our good friends who didn't. But it's been a great week, and I'm really pleased and proud to have the endorsement of an outstanding leader for Virginia in Governor McDonald. And so we end the week. You can come on by, ma'am. Well, nice to see you. Anyway, I'm going to go through some of the questions we have here from folks. Clark from Dumfries says that he believes that the hardest part of determining a good candidate is not only to rely on what he or she says or what they have done in the past, but determine what their values will be while in office. And so Clark asks, he says, what's your belief in the general principles of fiscal responsibility, free market, economy, and limited constitutional government? That's a good question, Clark. I'm one who trusts free people and free enterprise. I call myself a common sense Jeffersonian conservative. I don't like limits, I don't like restrictions. So long as somebody's not harming someone else, don't pester them. And I really dislike overreaching, nanny pestering laws from any government, whether it's local, federal, or state government. I think one of the key things that needs to be done, and the only thing I like seeing being restrained and restricted, is generally government. And at the federal level, the key thing that needs to be done is make sure that they're focused on their primary responsibilities, which are national defense and national security. And other than that, stay out of our lives and stay out of our businesses. One way of protecting the rights and prerogatives of the people in the states is to require the federal government to live under a balanced budget with line item veto authority in the Constitution as well. And those are similar to what we have here in Virginia, the way you run your household and the way that states and the federal government ought to operate. So trust free people and free enterprise. Make sure the federal government's focused on its primary responsibility, and the best way to make sure that they are doing it is with a constitutional amendment requiring a balanced budget and provide the president with line item veto authority as well. All right, I have a question here from Mason in Newport News, and he asks, last week in an email you mentioned that you wanted to repeal and replace Obamacare. What reforms would you make to our healthcare system? This is one of several questions I've gotten in the last few weeks on Obamacare, and my view is, yeah, we do need to repeal and replace Obamacare. Obamacare has been a really tough impediment on small businesses. They don't want to hire someone on because of that added cost, and so that's really been an impediment on growing our economy and jobs. It also is an unfunded mandate on the states with the expansion of Medicaid. One of the first things I'd like to see done after, and I'd love to be the deciding vote to repeal Obamacare, to replace it with some good ideas that'll work. Number one, with the states on Medicaid, which is healthcare welfare, let's remember what we did while I was governor on welfare reform. And I'd like to give the states greater flexibility to fashion and design their own Medicaid programs, which will save the taxpayers money and provide services that are every bit as good as it is now with this convoluted, expensive bureaucracy in Washington. So Medicaid definitely needs reforming by trusting the states to and have that flexibility to make the improvements. The other idea that I think is really important are health savings accounts. Let individuals own their own accounts. Give the tax advantages to families and individuals to have their own health care plan that they can take with them from job to job. It's portable, it's personal, and if you have that approach, people will care about the cost. The cost will be much less, and you'll be building up a nest egg over a number of years if you're not using the several $1,000s they might be put into that health savings account. Our whole family's using health savings accounts, and I think it ought to be made much more available to everyone, and that's the approach where people and doctors are making decisions about health care, not the government or employers.